Hi, my name is Callie Jones, and I'm a senior nursing student at Edgecombe Community College. We are doing a health literacy project, and today I chose to discuss COVID-19. COVID-19 has pretty much ruled our whole 2020. It started around here in North Carolina around mid-March, and nothing's been the same since. Our last normal day was pretty much March 13th. That's when you could go eat with your families anywhere, go out, go to concerts, go to bars, go to wherever you wanted. Now, most of those places are still closed, the large venues. And if you want to go to a restaurant, it's only 50% capacity. And most importantly, you always have to wear a mask at all times. Today, I'm going to discuss some topics that will help you if you decide to go out. The most important thing that our governor has stated, as well as the president, is that we should stay at home. However, some of us still have to go to work, and not everyone can stay at home. And also, there's people out there that just cannot sit at home all day. So we need to discuss some topics so that we can be able to go out and stay safe as well. The most important thing with COVID-19 is that we want to stop the spread of germs. The ways to stop the spread of germs is a few different things that we can be doing. Always wash your hands with soap and water for at least 20 seconds. If you can't wash your hands with soap and water, then use at least 60% alcohol hand sanitizer. If you have to sneeze or cough, cover your mouth and nose with a tissue to prevent the particles from flying all over the room as you cough and sneeze. Also, avoid touching your eyes, nose, and mouth. When you're wearing a mask, this is a lot easier to avoid touching your nose and mouth, but you also want to avoid your eyes because if you have germs on your hands, if you're touching your face, then you can contract it that way. Always avoid close contact with people who are sick. That also includes stay at home if you're sick. If you're sick, do not go out. Stay at home. There's no reason for you to be out. You can order your groceries, have someone drop them off. There's extreme circumstances, but please, please, please stay at home when you're sick. And always clean and disinfect frequently touched objects and surfaces. If your car handles, your doorknobs, whenever you leave and come back, always clean and disinfect your objects and surfaces that are touched most often. Remember with COVID-19 that you want to wash your hands for at least 60 seconds. If you don't have access to soap and water, but you do have access to at least 60% alcohol hand sanitizer, use that. But you want to scrub and wash your hands for at least 20 seconds. And that is from the CDC. That's their recommendation. So you can sing the happy birthday song twice, sing the ABCs, but make sure that you're washing your hands for at least 20 seconds. COVID-19 is all over the news. We all know what it is. It's a contagious respiratory illness that was originally first seen in Wuhan, China. Many people have mild or no symptoms. That's very important. This is from a Harvard Health Publishing health literacy paper that you should come back and look at if you have any questions. It describes what common symptoms are: dry cough, fever, shortness of breath. Less common symptoms: fatigue, muscle and joint pain, sore throat, and headache. It also describes how is COVID-19 different from the flu. How can you protect yourselves and others? Avoid close contact with people who are sick. Do not touch your eyes and nose and mouth. Clean surfaces. Wear your mask. Wash your hands. And stay home. That's the most important thing. If you can stay home, stay home. Also, how does COVID-19 spread? It's person to person. You can become infected by breathing in an infected person's cough or sneeze droplets from up to 6 feet away. And you can also become infected after touching contaminated surfaces and then touching your mouth, nose, or eyes, which is important. And that's why we talked about earlier about not touching your mouth, nose, and eyes. And high-risk surfaces include door handles, elevator buttons, counters, cell phone surfaces, and common areas. So clean those things at home. If you touch an elevator button going to work, then wash your hands as soon as you get there so that you're not contaminating yourself and you're not contaminating others. If you do contract COVID-19 or you think you may have come in contact and you're developing symptoms, or if you feel sick, stay home and call your doctor. If you're having difficulty breathing, suddenly feel drowsy or confused, notice your lips or face turn blue, then of course call 911. Most people with mild symptoms can recover at home. If you must leave home to see a doctor, call beforehand and avoid public transport. Also, if you call your doctor, then hopefully they can get you set up with getting a test if you would like. And but if not, then just stay at home till the symptoms have passed and do your 14 days of quarantine. Whenever you're outside of your house, you should always wear a mask. These two people work at our local Wendy's, and they're showing you the correct way that a mask should be worn. Next, I'm going to give a demonstration of how to put on the mask and take off the mask. Next, I'm going to demonstrate putting a mask on and taking it off appropriately to help lessen your chances of contracting COVID-19. So, I have our mask. 2 layers is what we like. Of course, when I'm working in the hospital, I wear my surgical mask, but if I'm just going out for a Target run or to get dinner, I'm going to wear a mask like this. So, I'm going to hold it by the fingers and put it on, and then make sure that the nose piece is tight. You don't want to be touching all the outside the mask, here, there. This mask is clean. I'm just using it for demonstration. But you don't want to be touching this because when people are coughing and sneezing, all the talking, all the germs can contract through the outside the mask. Now I'm going to demonstrate how to take it off to lessen your chances of contracting COVID-19 or any germs that are on your mask. So we have it on, and then I'm just going to go back behind my ears, take it off, and then either if it's a disposable, we're going to throw it away, or if it's a not disposable, try to just touch very gently and fold it over so we can take it home and wash it. And just by touching it like this will help keep all the germs inside the mask. It's so easy. My 5-year-old can do it, so she's going to demonstrate. If you have any kids, you can show them. Definitely kids are going to hopefully go back to school soon, so they'll have to wear their mask at school, so she's going to show how easy it is for her to take it on, put it on, and take it off. Alrighty. Okay, put your mask on. You put it behind your ears, and then you just kind of tighten. Show how you tighten the nose piece. Yeah, and then you remember you don't touch it or anything. And now when it's time to take it off, you take it off and and then fold it so the dirty side is in. Very good. Thank you. In conclusion, with helping protect yourself from COVID-19, if you leave home, know your W's. This is a clip from the North Carolina DHHS website that shows how to stay strong during COVID-19 here in North Carolina. Few key points to remember: always wear your face mask. If you're out and about, stay at least 6 feet away from people. If you're waiting in line, the store, make sure you're 6 feet behind people. Always wash your hands with soap and water. If you can't use soap and water, then you can use at least 60% alcohol, and just try to stay safe. And I hope this video gives you a few clips to learn how to protect yourself from COVID-19 and what to do if you have to go out. Thank you.